Welcome to Discover Midwives, the podcast where we explore the art, science, and impact of midwifery. I'm Jessica Brumley, and each episode we'll uncover the stories, the history, and the expertise of midwives. This is your space to learn, connect, and celebrate the power of midwifery. Let's discover midwives together. Welcome to the Discover Midwives podcast. Today's episode will be focusing on prenatal care. I always like to start with a story, and recently I had a couple come in and they were a bit late in entering their prenatal care, and they made a comment, something along the lines of, let's be real. Most of these appointments are just going to be fluff. Like, I don't really need to come in for all of these appointments. We had, I think, a really great conversation after that. And I let them know what I think is so important about prenatal care. And it made me think that this was a topic that we needed to talk about together. Because there's a lot that is unknown or maybe understood about what happens during prenatal care. And depending on where you go, I think maybe sometimes visits can feel a bit, I don't know, transactional almost. But I let them know, I think prenatal care is an opportunity for us to form a really trusted relationship so that you have someone who you can really lean on when you have questions and concerns, and that you feel safe with the team that's going to be caring for you during your pregnancy, labor, and birth. And that relationship building is what really helps to improve outcomes. But there are a lot of things that happen during prenatal care that are really important too. And so I wanted to outline that for you today and talk about what is prenatal care, what's going to happen during your visits, and what can you expect to be offered, how can you help to optimize your care, and what choices do you have as far as your care providers and care locations are concerned. So there's some key components of prenatal care. Taking your history is really important. We want to know all about your health history, your family history. What do you do for work? What's your life like? We want to really know if there are any medical complications that will impact your pregnancy and labor and birth. And that helps us to guide your care and provide you options. A physical exam, some component of a physical exam happens at every prenatal care visit, but the first prenatal care visit is where we offer a complete physical exam. And this physical exam is really important because we want to assess your health right from the beginning of pregnancy. The sooner we know if there's anything that we need to address, the better. But also because many people, particularly young, healthy, reproductive age people, they stop seeing a pediatric provider at some point. They feel fine and they don't get checkups. Many of the people that I care for also have limited access to care throughout their life, whether they're coming from another country or have just had limited resources. And this is an opportunity for us to provide a full physical exam for people. I had somebody one time who had a cardiac anomaly and that was detected but when we listened to her heart at her first prenatal visit. So this is something that that's really important. And then there are a ton of labs that are offered. And the labs at the first prenatal visit are the most that you'll get at all of your appointments. And so oftentimes people think, oh my God, how many tubes of blood are you going to take? This is so many. But I promise it's never as many as you get at your first prenatal visit. What do we check at the first prenatal visit? We want to know your blood type. That's important. A blood count, because anemia is something that can impact how we oxygenate our body and our baby for that matter. And so detecting that early is important. We screen to see if you are still, if you have immunity to infections such as the chickenpox or varicella, German measles, or rubella. And also screening for infections such as syphilis, hepatitis B and C, HIV, gonorrhea, chlamydia. These are infections where that can be treated or managed to help to optimize your health and also potential risks to the pregnancy and the baby. If you're not up to date on your cervical cancer screening, we can do a pap smear. We check for infections in your urine because we're at greater risk of kidney infections in pregnancy that can increase our risk of preterm birth. And so all of these infections and screenings will be offered. And then there are also some genetic tests that can be offered. For most people, that includes blood work to see if you're a carrier of a gene for cystic fibrosis, spinal muscular atrophy, sickle cell. Those are the most common, ones that we screen for. These are conditions where both you and your partner would need to both be carriers of it in order to have a baby affected by that condition. And so if you screen positive, you may choose to have your partner screened. And then another genetic test that we offer is the cell-free DNA testing or the non-invasive prenatal testing. Many people think of this test as a test that tells them the gender of the baby because it can detect the sex chromosome. Many people get excited about this particularly because it can give them this information before the anatomy ultrasound. But also, if you want to keep it a surprise, they don't have to share that information. But also, this test helps us to screen for trisomy 18, 13, 21, Down syndrome. And so that's a test that can be done depending on the lab that you go to, maybe as early as 9, 10, 11 weeks in the pregnancy. Oftentimes, an ultrasound is done at this first prenatal visit as well. And, I've been practicing long enough that I remember a time where we didn't do routine ultrasounds at the first prenatal visit. If you had a sure last period, we would do a physical exam. We could feel the size of your uterus and determine how far along you are. And that's still certainly an option if somebody chooses not to have an ultrasound. But an ultrasound can be very accurate in helping us to predict what your due date will be, or how many weeks pregnant that you are, particularly if you're in that first trimester of pregnancy. That ultrasound is very accurate at helping to determine that. So there's many tests that are offered at that first visit, and I think also extremely important is just getting your questions answered, helping with your symptoms that you may be having. Almost everyone is having some nausea or vomiting, fatigue, headaches, constipation, all those early pregnancy symptoms. We can problem solve and strategize on how to get through this first trimester and the early weeks of pregnancy together, and really start to form that relationship that I was talking about, right? Like understanding that we're here to help and to support you. And hopefully, as you learn to trust us, then you feel comfortable sharing things with us that maybe you wouldn't feel comfortable sharing before. And so we often ask about really personal things, like, if you've ever had any kind of, history of trauma or of substance use disorder, or if if you have enough food to eat at home. Some people really feel embarrassed by these questions, and they may not want to answer them or want to answer them truthfully at that first visit. But as we develop these relationships, and my hope is always that people feel really cared for and able to be more open with us, and so that we can support them even better. So that first visit should happen, I don't know, as early, as once you find out that you're pregnant, as early as your care provider can see you, the sooner we know if there's something we need to address, the better for you and for your pregnancy. And then visits after that can the can be individualized, but on average, people are often come in every 4 weeks in the beginning of the pregnancy through 28 weeks, and then every 2 to 3 weeks through 36 weeks, and then often weekly at the end. That's been the standard for a really long time, but there's no magic formula to that. Okay. Like if that doesn't work for you for some reason, or whatever it is, it should be personalized. Oftentimes, I talk to people about, do you want to line up your next visit with when this next test would be due? Or sometimes people are feeling really anxious in the beginning. Maybe they're not feeling the baby move. Maybe they want to come in actually more often so they can hear the heartbeat. Right? Let's talk about that. Let's make a plan together to figure out what works for you and your needs in this pregnancy. Your follow-up visits are generally not as extensive, right? So we've learned about your history. We've completed a thorough physical exam at that first appointment. What does the next appointments look like? Okay, well, how have you been feeling since your last appointment? What's been going on? Let's talk about that. And then your physical exam is limited now usually to your blood pressure, your weight. We do what's called a fundal height in order to determine if the baby seems to be growing appropriately. And the fundal height is a measurement with a little measuring tape in centimeters from the top of your pubic bone all the way to the top of your uterus, which is what we call the fundus. And it should equal in centimeters the number of weeks that you are, give or take like 2 centimeters or 3 centimeters. We know there's a little variation in body sizes, but if it's much more often 2 centimeters consistently, then we will often order an ultrasound. And this is to see if the baby's growing appropriately, if you have sufficient amniotic fluid around the baby, and to make sure that everything's okay. Um, Usually that big ultrasound that we do is called a complete or detailed anatomy ultrasound. That's done at around 18 to 20 weeks in the pregnancy. And this is a 30 to 45-minute ultrasound. This is like all the parts they're looking at. The nose, the lips, the heart, the kidneys, the spine. They're measuring all the parts of the baby and making sure everything looks like it has formed properly. And then after that, we're only ordering ultrasounds. Typically, if somebody's having a healthy pregnancy, we only order an ultrasound if those measurements are off that I mentioned, right? So if if your measurements are off, then we want to explore that a little bit more. Sometimes our measurements are off just because of how we're carrying our baby, and the ultrasound shows that the baby's growing just fine. That happened to me in both of my pregnancies. I don't know. I think I just had like a small torso or something, and so I always measured really small and had normally, grown babies, thankfully. The additional lab work that can be ordered includes the AFP, short for alpha fetoprotein. It's a blood test that can be done between 15 and 20 weeks. It helps us to screen for risk of spina bifida or neural tube defects. The ultrasound looks for that, but no test is perfect. And so that's one test that we will offer. Between 24 to 28 weeks, we offer the glucose challenge test, and that's a really sweet, sugary drink. An hour later, we draw your blood to see what that level is in your blood. Some people can develop diabetes in pregnancy, and this is a test that helps us to screen for diabetes in pregnancy. And usually around that time, we're also repeating a blood count because many people do develop anemia. We're making a lot more blood volume for our baby. And so that process of making more blood volume can lead to a bit of anemia. And so we want to be sure that we are optimizing your hemoglobin levels before you bleed during the birth process. And so sometimes iron supplementation is needed. We even sometimes send people for iron infusions to make sure that they're having a healthy blood volume and a healthy hemoglobin level. Your hemoglobin is also how you carry oxygen in your body. So it's how you nourish your baby. And that is how also the baby grows, right? So if your baby's well oxygenated, then it grows well and it is more likely to be able to endure the stress of labor and birth, right? The contractions squeeze the baby and cut off some of the blood flow to the baby, which is normal. But if your baby's I don't know if your baby if you've been anemic and the baby hasn't been getting enough oxygenation, that it might get more stressed out by labor and birth. And so really making sure we stay healthy in that way is important. And so that's the rest of the blood work that's standardly ordered. Sometimes we also recommend repeat testing for syphilis, hepatitis, HIV, gonorrhea, and chlamydia in the third trimester. And that's because sometimes if you had an exposure to any of those infections right before pregnancy, they maybe wouldn't have come up positive at that first prenatal visit. And it's so important to the health of the baby that we will offer that again in that third trimester. And then lastly, the last test that we'll recommend is a group B strep or group beta strep vaginal culture. And that's a Q-tip swab that is placed vaginally and then into your rectum to help to detect a bacteria that doesn't cause a problem for us, but could cause an infection for the baby. And if the baby does develop this infection, it actually can develop sepsis and need to be in the NICU and really could be very dangerous. But if we give antibiotics in labor, typically penicillin, then that significantly decreases the risk of infection to the baby. And so this is routinely recommended between 36 to 37 weeks. Actually, in our practice, we offer people the option to collect that themselves. And so usually they'll just go into the restroom and collect that swab themselves at that visit. So those are the different lab tests that you can expect to be offered to you. And I always say offer because we can't mandate anything, right? Like nobody can mandate anything for you. There are reasons, many of which I have explained today, why these tests are offered. And there are reasons why somebody might decline any of this testing. And that's always okay, so long as you have been informed on what the recommendations are and how that might impact your health and your care. For instance, if somebody's planning a home birth, we really need to make sure that they're not anemic, because it maybe wouldn't be safe having a home birth. And so that blood count that I mentioned, maybe isn't optional for someone who is planning a home birth. And so, understanding why the tests are recommended and what impact that may have on your health is really important. I mentioned that education is a really important part of your prenatal visits. Bring your questions to your appointments. You want to have all your questions answered. We want to answer all your questions. And you're much more likely to get them answered if you have a list. I always recommend to my patients to get out their little notes app on their phone, because nobody ever forgets their phone, but they always forget the little sticky that they wrote their questions on. Bring that into your appointment. And is it okay if we answer my questions first? You can say, yep, absolutely. Go for it, I say. Because oftentimes your questions are things I wanted to talk about anyway. And I would much rather it come from you than me bring it up. So I would love that. And the other thing that also helps to make sure that your questions get answered is to bring your loved ones with you. Who are your support people? Number one, they remember questions that you forget, right? They remember things that you mentioned in passing about what was hurting, or I wonder if this is normal, and they're going to bring that up. Number two, they benefit from the conversation, right? They now know how to support you better, how to encourage you better, how to, maybe how to cook differently, or what to shop for with the snacks, or when to just go, listen, that's normal. I'm not going to take that personal. She's got her hormones going, right? Like all of that, that education and conversation that happens during your prenatal visits, it's not just beneficial for you, but also beneficial for the people who love and support you. I love when people bring their little ones with them, right? Their other children. I think that's an amazing opportunity for them to connect to their sibling, and I love to include them. I think it's really fun to have them help me find the baby's heartbeat, and to really make it a fun experience. But I also love when the support people are there, and I can talk about things like, what's that postpartum period going to look like, and what kind of support is she really going to need, and how do we make sure that this person gets the support that they need. And so, bringing in your loved ones and your support is a really important part of your prenatal care. And if they can't make it, if they're at work, I mean, that's okay. But let's be creative. Let's think about how can we include them. Maybe just phone them in. I've had many of people on the phone with their sister or their partner or their husband, whoever, during the visits, and that's fine too. That's great. Ask your questions and include them in whatever way that they can be included. I also wanted to talk about the different types of care that can be provided, maybe the different types of prenatal care, and how it might look different. So, if someone is planning a home birth, then their midwife might provide prenatal care in their home. They might go to their place of employment, or they, may go into an office or a clinic setting, to see their midwife. And some people really like the option of having, that kind of care that's really personal in their space. Maybe it's a lot easier to include your family in your prenatal appointments if they're happening where your family lives. And so that's, one thing, one kind of care. Then you may choose to have care at a birth center. And some people have care at the birth center, but plan to attend birth in a hospital. And some people plan to have birth in the birth center and have their care in the birth center. Both home birth and birth center prenatal appointments tend to be longer, and they tend to have more time to dedicate to education and support. So that's one thing to consider as well. How much time do you want to have in your appointments? Many of us who work in traditional medical or hospital-based practices have visits that can be a bit shorter. I have to say, I think after years of doing this, I've developed some skills in being able to still provide high quality prenatal care in 15-minute prenatal appointments. But I also recognize that longer visits, which can feel like a luxury to me sometimes, are really beneficial. And so, if that's important to you, those are things that you may want to think about. One model of prenatal care that has really helped to, I think, optimize time to be able to provide education and support is a group prenatal care model. And so there are different group prenatal care models, but this is a model where you have care with other people that are due around the same time of you, or maybe there are groups where people share a similar aspect. So maybe they have language specific groups like a Spanish speaking group, or maybe they have like a teen pregnancy group, or maybe they have a group for diabetes, right? So you may find a group that is that feels like it fits you better. But in general, most groups are based on their your due date, and having similar due dates means that you're usually having similar experiences, and the appointments, because there are many people in that setting at one time, are longer, right? So you might have 2 hours in a group to really get to know both your midwife and whoever else is facilitating the group. That might be a doula, a nurse, a medical assistant. So really developing those relationships and connections, also the relationships with the other people whose experiences can be so valuable. And having, that longer visit allows you to be able to really connect and form relationships. And so that's another model of care that you may want to explore. And I think we could do a whole podcast episode on that. And then also thinking about continuity of care. So whether you have an appointment with the same or a small group of people, or you try and meet someone different every time. I often have people say, I want a chance to possibly meet any of the people that might be there when I have my baby. And I get it. You don't want a stranger with you. But I also recognize that in some groups, they are so large that you may never meet everyone who might be there when you go in to have your baby. And so that means meeting someone different every single time, and maybe not getting a chance to have a person or even a small group of people who you can really depend on. When you have that question and you need someone to guide you through it, do you have a relationship with someone who can help you through that? I encourage continuity of care in part because the research shows that having continuity of care with a smaller group of providers does improve experience and outcomes. And so really thinking about having at least some of your visits recurring with the same person to really start to form that relationship really it is critical. We've gone over a lot of options for prenatal care, and I think a lot for people to think about. Education and support, going through options, this really depends on developing our relationship. And I mentioned earlier how when that patient asked me, like, most of these visits are fluff. I don't think that's fluff, right? I think that is foundational. And I read a quote on the Instagram page for Educated Birth. So if you don't follow the Educated Birth, I really think you should. And the quote was, "Feeling safe in care is not extra. It's foundational. Being listened to, respected, having our autonomy honored, it changes how the body responds before, during, and after birth experiences." So if you're pregnant, you deserve to feel cared for. You deserve to have a relationship with the people that are caring for you. Chronic stress, fear, instability, that changes us physically. And optimal health requires spaces where people feel safe, whether that's in your home or in a healthcare facility or in your community. You deserve that. You deserve to feel safe, and you deserve to have optimal health. And they go hand in hand. So, as I wrap up today, I wanted to leave you with this. You deserve care that listens to you, respects you, and includes you in every decision about your body. If something in today's episode resonated with you, I encourage you to write it down, talk about it with someone you trust, or bring it with you into your next healthcare visit. Information is powerful, but using it is where change begins. If you found this episode helpful, you can follow or subscribe wherever you listen to podcasts. Sharing this episode helps more people learn about their options and what respectful maternity care can look like. Thank you for spending time with me. Take good care of yourself, and I'll meet you back here next time.
Discover Midwives was brought to you by the American College of Nurse Midwives. To find a midwife in your community, go to midwife.org.